Have you ever had a moment of sudden weakness, clinging to your body, leaving you in a state where you struggle to speak, see clearly, or maintain your balance? If yes, then you might be experiencing transient stroke, which could be a warning sign for the potential arrival of a devastating stroke. But what actually causes a transient or mini stroke, and what could be the possible signs of it? Join us as we unravel some crucial and gripping signs that demand your immediate attention if you have a transient or a mini stroke. Before we get into the main details, it is very important for us to know what exactly is a transient stroke. A transient ischemic attack, or TIA, is a momentary disruption in blood flow to the brain. The clot normally resolves on its own or becomes dislodged, and the symptoms last no more than 5 minutes. While a TIA cannot cause permanent damage, it is a warning stroke that indicates a potential full-blown stroke. Many people may identify the classic symptoms of a TIA. However, new research indicates that less prevalent symptoms may go unrecognized. That's bad, because a TIA is a clear warning that something is wrong with the brain's health. Experiencing one raises a person's chances of getting a permanent stroke in the near future, maybe within the next few days. Knowing the full range of probable TIA symptoms may help you or a loved one identify a major risk factor for an oncoming stroke. Your healthcare professional can then advise you on whether you require additional testing and, if necessary, begin treatment to minimize your stroke risk. So what are the signs of a TIA? Well, there are some early signs for this lesser-known yet significant neurological event that can have a lasting impact on one's life. Because different areas of the brain have different tasks, the symptoms that occur during a TIA depend on the part of the brain in which blood flow is disrupted. So here's an outline of some common symptoms that are associated with transient or mini stroke. 1. Numbness or drooping. One of the most common symptoms of a transient stroke in elderly people is sudden weakness or numbness that usually occurs on one side of the body. This can affect the face, arm, or leg, and may cause difficulty in moving or lifting the body part that is affected by the stroke. During a mini stroke, the lack of blood and oxygen to the brain can affect its ability to process sensory input, affecting muscles, nerves, and skin. Because strokes typically affect one side of the brain, it is very common for this symptom to impact only one half of the body. If you struggle with any sensory issues, it is important to seek advice from your doctor. Furthermore, if you are experiencing a new or sudden onset of numbness or tingling, this may be a sign of a medical emergency. Familiarize yourself with the different stroke warning signs and get immediate medical help if you or a loved one are experiencing this symptom. In addition to facial drooping, weakness of the limbs, or speech difficulties, the sudden onset of numbness can indicate that a stroke is occurring. 2. Slurred speech or difficulty speaking. Another common symptom is slurred speech or difficulty in speaking clearly. A person who is experiencing a mini or transient stroke may have trouble finding the right words or to form them as they speak. This can also cause a problem when a person is trying to make coherent sentences and their speech may appear unintelligible. Thus, a transient stroke may affect the cognitive function of the brain. This happens because a lack of blood and oxygen to the brain can affect the muscles associated with speech, such as the tongue and lips, and interrupt important speech-related signals from the brain. There are some common speech problems that are associated with transient strokes, one of which is known as dysarthria, which occurs when a person cannot speak clearly and/or slurs their words. They may speak too slowly or inaudibly, or their words may be completely incomprehensible. Dysarthria is the most prevalent speech symptom in the initial stages of a severe stroke. Another one is called aphasia, that refers to a wide spectrum of language processing difficulties. A person with aphasia may have trouble inputting and outputting information. Aphasia might seem as incomprehensible jumbles of words, made-up words, or an inability to speak. Then we have apraxia, which is a physical speech impairment that affects the ability to talk clearly. Thus, it is very important to see a doctor or get some medical assistance if you're having this symptom. Keeping an eye on the pre-existing conditions will save you from a big trouble and will also help you to come out of a situation like this. 3. Severe headache. Although a serious, painful headache might be attributed to a variety of ailments, a debilitating headache that comes unannounced and without any other explanation could be a symptom of a stroke. A stroke-related headache causes pain that is sudden and extreme. This is different from a migraine-related headache, for example, which begins as a throbbing pain that gets progressively worse and comes with a variety of additional sensations, such as the feeling of tingling skin and seeing auras. If you experience a strong headache that comes on suddenly and is unlike any pain you've ever had before, or if you have any other indications or symptoms of a stroke, get emergency medical assistance right away. A stroke can be fatal and each minute counts. Strokes cause brain damage, and early detection and treatment are critical for avoiding long-term complications. Even if you are not having a stroke, a sudden, extremely intense headache may indicate other dangerous medical issues, for example, hemorrhage or infection in the brain that must be addressed immediately. 4. Confusion. A person with a mini-stroke may become disoriented, frustrated, or confused. They may not know who they are, where they are at, and what day it is. Symptoms may last only a few minutes and be reversed if treated immediately. Confusion can turn into more serious cognitive issues such as severe memory loss and dementia if left untreated over several hours. 5. Syncope or fainting. Syncope is a sudden loss of consciousness and muscle control that usually lasts less than 5 minutes. The blood supply to part of your brain is disrupted. You may regain consciousness on your own or need immediate medical attention. A severe fainting episode can lead to other symptoms and should be checked by a doctor right away. 6. Dizziness or issue with balance. Dizziness or difficulties with balance are sometimes the first indicators of a mini-stroke. More broadly, it's important to understand that the symptoms of a mini-stroke vary depending on which section of your brain is affected, which means that you may have some symptoms but not all. Also, if you notice anything strange, especially any signs of a stroke, for example, weakness on one side of your body, visit a doctor straight once. So how can transient or mini-strokes be prevented? While strokes are prevalent, especially among the elderly, stroke prevention can reduce the chance of both minor strokes and more severe ones. The Centers for Disease Control and Prevention suggest that people adhere to the ABCs of stroke prevention, which are as follows. Aspirin. Regular usage of aspirin can be an effective prophylactic measure. But in case of an active stroke, it is important to get some immediate medical help as aspirin cannot be used to treat that. Blood pressure. You should be consulting your doctor on a regular basis to check and treat your blood pressure levels. Cholesterol. In order to prevent transient strokes, it is important to control your cholesterol levels through diet and medication. Smoking. The significant health risks associated with smoking have been known for some time now. Because smoking can cause significant cardiovascular distress, it can drastically increase stroke risk. Strokes can be intimidating, but taking an action in time can save you a lot. Although every person's prognosis after a mini-stroke is unique, based on a myriad of individual health factors, being able to recognize a mini-stroke and get medical attention can be extremely beneficial for long-term wellness. It is critical to get someone experiencing a stroke to the hospital as soon as possible so that life-saving measures can be performed. Patients with ischemic microstrokes can receive medication to dissolve the blood clot or obstruction that is restricting blood flow. Even though mini-strokes might appear mild, receiving immediate medical care and possible treatment is vitally important. Because mini-strokes can also be thought of as warning strokes, medical interventions can help prevent more severe strokes in the future. This might, at the very least, push doctors, patients, and their families to work together to be proactive and more aptly prepare for situations that may arise in the future. And there you have it. Let us know in the comments if you've experienced any of these transient stroke signs. If you enjoyed watching the video and found it informative, then hit the like button, subscribe to our channel, and don't forget to ring the notification bell so that you always stay updated with our latest content as soon as it's uploaded. Thanks for watching and see you in the next one.